I think it's a very community-based hospital, but there's a lot of people there. So
Yeah.
I think that's just a function of how big the ER
That's
is.
I wonder if that's not because of the ability of a nurse practitioner or a physician's assistant and the price point at which they could, have them on board, because an MD is going to be a lot more money than a nurse practitioner, of course. But I'm curious. I mean, I don't know. I mean, yes, they're capable, yes, I'm sure they're just as good to a certain degree, but I've worked with some absolutely amazing nurse practitioners. I've actually worked with more nurse practitioners. Actually, they're MPs. Yeah, let me see here. Physician's assistants. And most of the ones I work with are physician's assistants in the OR. And a lot of doctors have their own, PA, especially in the orthopedic world. And I mean, tell you some, there, I work with one over the hill, and I watch the doctor and him synergistically go through, and we'll do a total knee replacement in 38, 40 minutes, which is ridiculously fast. If you know anything about OR in, orthopedics, a total knee for a normal surgeon, hour and a half, hands down. That's going to take them. But these guys are literally swapping instruments in tow, going back and forth, suturing, putting it. It's impressive, and so
Yeah, and I was going to talk about how, or piggyback off of what you were saying about doctors' different styles, and they have to learn that. So, how important is that as a nurse, but also as like a tech or a PA? I mean, you said they do a total knee 30 minutes, which is
you don't know you're a doctor, you're not going to survive. The OR is a lion's den, and if you're soft skinned, if you have a thin skin right there, you're not going to make it, because you're going to get yelled at. The doctor is going to yell at you at some point. The doctor is going to get furious at you because you didn't have whatever it was. You weren't 3 steps ahead. If you're in the OR and you're not 3 steps ahead of the doctor, you're behind a mile, and you are going to get yelled at. And I've seen a lot of nurses break down and cry, and just they're gone. It doesn't work. So you take your licking, you realize, hey, this is what he likes. You make sure you make a note of it, mental note, personal note, physical, whatever you need, and you move on. Otherwise, you're done.
yeah, that's huge. That OR culture can be very malignant.
It's brutal. Yes, it gets brutal. And I mean, the doctor I worked with today, he got very frustrated over a couple little things. It wasn't very big, but it was also getting late, and he wanted to be done sooner, but it was more him than us, and the patients were a little more difficult, and it happens, and you get backed up, and he wasn't having it. So he wanted to lash out to feel better, and it's fine. We all know him. We knew it was coming. No problem. It wasn't disrespectful. He was just frustrated, and brush it off, move on. Next.
Yeah. I've seen on social media that there's a few nurses that just get, I don't know what the right word is here, but their doctors are not so respectful to them.
Yeah.
And that could end up becoming a problem. How big of a phenomenon is that in nursing?
I think it's a pretty big issue. I think that it's a phenomenon that happens more often than not, but also, there is some truth to, maybe you're not cut out for it. Maybe that's not where you should be. Maybe you shouldn't be in the OR because you aren't, look, there's a difference between a doctor being an asshole, excuse my language, or he's just going, hey, I like this done a certain way, and I shouldn't have to ask you to, do this, or, put this tool there, or whatever, I want the fluoroscope in a position like this, you either know it or not. And if you're not capable of stepping in and go, doc, I understand, it's my first time, I'm learning, I promise you I'll have it down next time. If you can't do that and you can't voice your opinion, you don't belong in the OR. I have no problem stepping up and going, I understand, sir, take a breather, I promise you I will have it down. Just be more clear with what you're telling me. I won't forget for the next time, and I'm taking notes. And when they realize, I think that's the key one. When they realize you're taking notes, you're showing them that you care, and that you're going to make it, the next time it won't happen again. Now, if it does happen again, you're probably not going to make it in the OR.